Well, the Indiana Primary Health Care Association oversees some 35 community health centers in the state, and a new study shows that in addition to providing care, they also deliver a hefty economic impact. Business of Health reporter KYLIE VELETA has more. KYLIE.
Thank you very much, Gary. Community health centers, or CHCs, are nonprofit, community-based primary care clinics that focus on underserved populations. A recent study by the Center for Health Policy at the IU Fairbanks School of Public Health shows CHCs have a nearly $1 billion economic impact in underserved areas of Indiana. Joining me now to tell us more about the growth and what it means is IFCA Chief Executive Officer Ben Harvey and Dr. Don Haut, Chief Executive Officer of Eskenazi Health Center, one of the largest CHCs in the state. Thank you both for being on the show today.
Thanks for having us.
All right, Ben, let's start with you. This economic analysis, very recent report about CHCs in Indiana. What do you think are some of the key highlights from a big picture perspective?
Yeah, well, thanks. And again, thanks for having us on. I think the big highlight's the one that you already laid out, which is health centers have $1 billion economic impact in underserved areas in the state of Indiana. And that's critical because health centers are designed to be in medically underserved areas. And we can kind of extrapolate there and say medically underserved areas are also likely to be economically distressed areas. So not only do health centers provide access to high quality comprehensive primary care services, they also provide that economic benefit. So they really begin to address the needs of the community at multiple levels. And that's important when you think of impacting the health of Hoosiers. You know, in addition to that, we've seen a big expansion of the community health center model in underserved areas in Indiana. So that $1 billion number is about 5 times what it was 10 years ago when this study was done previously. And in addition to that, too, you have the impact that health centers have as employers. So they have that generalized economic impact. They also provide a hefty dose of employment. So about 6,000 jobs, indirectly and directly, in underserved areas of the state. So it's pretty significant information. So not only are they the providers of healthcare and those access points that underserved Hoosiers need, but they also provide a big economic impact.
Lots of strong numbers, lots of big impact there. Dr. Haut, that's kind of a statewide picture. Let's drill down to the local level. Eskenazi Health Center is one of the largest CHCs in the state. Talk a little just about the local impact these CHCs have in terms of delivering care.
Yeah, and again, thank you for the opportunity to speak to you today. You know, whether you're in an urban area or whether you're large or small, all of our health centers really have a similar impact on a community. So pretty much everything I would say to describe our Eskenazi experience has really been the experience of all of my colleagues throughout the state and the country. Our health centers are located in the communities where we serve. We hire our staff from those neighborhoods. The demographics of our staff match the demographics of the communities where we provide care. Our doors are open to everyone. We do not turn anybody away. And oftentimes under one roof, we have multiple services. We're kind of a one-stop shop, including lots of things that we know now, like social determinants of health is a hot topic these days, but health centers have been talking about this and doing this work for decades when we understand the impact that food insecurity, for example, has on health. So while our health centers are making a nice economic impact, we're also really having an important impact on health outcomes. We are, our health centers across the United States actually are the largest primary care network in the United States, and we have some nice outcomes to show for that.
All right, and speaking of health outcomes and delivering care, obviously Indiana is in the thick of a health crisis. Ben, talk a little bit just about the unique role that CHCs have played in Indiana as we've been dealing with the pandemic.
Yeah, certainly. So yeah, I think a big thing to highlight here is the collaboration that health centers have had with the state, with the Department of Health. You know, Dr. Boxer and team have been doing a fantastic job at a very difficult time, and they have done a really nice job of engaging health centers and leveraging, like what Dawn just talked about, that community connection and the connection that health centers have with the communities they serve, communities that are oftentimes hard to reach in terms of delivery of healthcare services, but also public health messaging. There are oftentimes trust issues that come into a number of the communities that we serve, whether they be urban, whether they be minority-based, whether they be rural communities. There are oftentimes issues in the communities that we serve. And health centers have played a key role in connecting their communities to the resources that are necessary to combat the pandemic, right? So things like testing, things currently like vaccinations. A number of health centers, a large number of health centers here in the state of Indiana have begun directly providing vaccines to their communities at large, not just their patients, but also other members of their communities, and serving as access points in areas where there may not otherwise be access. And in addition to that, I mean, I think one of the things that we forget about in the middle of the pandemic, because we just talk about the pandemic, COVID-19 all the time, is that people are still getting sick, people still have hypertension, people still have diabetes. They're all the ongoing health concerns that we normally have. They just kind of are flying below the radar right now. But health centers have done really a great job of leveraging technology, taking advantage of things like telemedicine, the flexibilities that we have now to provide telemedicine in new and unique ways, and the different technologies and modes that previously may not have been used as much. The health centers have really done a nice job of integrating those into their daily delivery systems with the intent of providing more access for their patients where they may not otherwise be able to get it because of things like closures or whatever else. So health centers, I think, have done a really nice job of filling in that access gap and trying to continue to reach patients in ways that there may be difficulty in the middle of a pandemic getting that access that patients routinely need, and not dropping the ball on things like your hypertension medication or checks for your diabetes, not dropping the ball on those things.
Okay, well, Ben, Dr. Haut, thank you for sharing the report with us. Gary, back to you.